Hello, namaste everyone. Nowadays we are seeing many complications during delivery. It may be complication to the pregnant woman or it may be complication to the newborn baby, right? Before we were not having any history of complications much more. But nowadays as technology developed, we have much facilities. Then too, like our females are suffering with many complications during delivery especially, right? We all know what is the cause for this? No, right? So today I am going to explain about this. Why are the complications are increasing during delivery? It may be complication to the newborn or it may be complication to the mother. So namaste everyone. This is Dr. Meenakshi. I am an Ayurvedic pediatrician. So when I was doing a survey like why newborns are suffering with many complications like stillbirth or neonatal asphyxia or meconium aspiration, these all stages are increasing. It may be respiratory distress. These all are increasing nowadays. Probably in 10 newborns, 1 or 2 will be suffering with respiratory distress or meconium aspiration, something else, right? So when I was doing study about this, what is the reason for many complications nowadays? Though we have so much well sophisticated technology, I got one point, that is about the supine position of a delivering woman. As we all know, we have 4 stages of labor, right? But in initial stage and in second stage, there is no need to be in a supine position for delivering woman. In those stages, she can be active like walking, it may be like some physical activities like ball exercises or something else. And when cervix fully opened, when baby is ready to move down, then she can lie down in a supine position and she can take a newborn baby out. But not all hospitals, now I am not blaming for every hospitals, but in few hospitals what they are doing, as contraction starts, they will give a hormonal injection to increase the contractions and they will make a woman to lie down on a supine position. This is the main reason where we are getting many complications in newborns and even like hypotension, hypertension, like complications in delivering women. Why? Because as we all know, like behind or like little side of the uterus, there is a passage of vein, that is superior vena cava and inferior vena cava we have, which supplies blood to the heart, right? In medical terms, in who all are medical field, we know it. Because of this reason only, even gynecologist will advise a delivering woman, especially in pregnancy, when woman gets pregnant after second trimester or during second trimester, they will advise not to sleep in supine position, right? Why? Because if she is on supine position, this uterus will make pressure on inferior vena cava and it will hamper the blood supply to the superior vena cava and it will hamper the blood supply to the heart of woman. Obviously, we all know the blood supply to the placenta, everything will be goes on in a same process with the woman and fetus and placenta, everything, right? So due to this reason, there will be hampering in the blood circulation in woman's body also and also for fetus also. Because of this, the complications are occurring. Because if the woman sleeps, especially in last trimester, a woman sleeps more than 10 minutes in a supine position, this inferior vena cava blood circulation will be hampered and it will cause hypotension, hypertension or respiratory distress in newborns. Many more complications will occur. So now we got to know what is the cause. So what is the solution for this? To find solution for this, the team known as ABGP, Akhila Bharatiya Grahaka Panchayat, has find out the solution for this and they started the project named as Lajja Gauri. Lajja Gauri project's main motto is to create awareness about this delivery process, how we have a lithotomy cot for delivery in a hospitals, that same lithotomy cot, but it is head elevated chair-like structure with the rod named as Lajja Gauri rod that they created. Even I'll add a pic, you can see. This Lajja Gauri rod will help the woman to give pressure in her first stage and initially in second stage. When her cervix opens fully, even if she is comfortable, she can deliver a baby in sitting position only, or at the end stage when baby is ready to come out, lie down in a supine position and she can deliver. So this is the process to avoid the complications which all we are getting during delivery nowadays. So due to this, many women who are able to do normal delivery also, due to prolonged delivery, they are going for emergency C-sections. So to avoid this, we can follow the Lajja Gauri rod and we can avoid the complications, and even we can avoid the cesarean sections delivery, right? We are not opposing this cesarean section. Even doctors want to be mother and baby safe, so they will advise cesarean section. But the women who are already have a complications in pregnancy, or who already know that they can't deliver a baby in normal delivery, obviously they can opt for cesarean section. But we are at the point who are able to do normal delivery, but due to prolonged labor they are going into emergency C-section, or they are going to complications. To avoid this, we can follow Lajja Gauri rod. This is very good point and great opportunity for us all to get awareness about this Lajja Gauri rod, and thank ABGP to provide this awareness, right? One day we should be so aware that every delivery rooms should be with the available of Lajja Gauri chair, which I showed already a pic, so that we can avoid the emergency C-sections, and also we can avoid the complications in newborn and even a delivering woman. So if you all find this video as a helpful, you can share with your friends, neighbors, relatives, everyone. Someone will get awareness about this Lajja Gauri project. They can share this knowledge with each other, so that we all will get a knowledge about this to avoid complications in delivery. This is Dr. Meenakshi signing off. Thank you.